Hey guys, do you want to do a career in community medicine or in public health? So there are a few options for you. If you're doing your undergraduation in MBBS or what is called as the Bachelor's in Medicine and Surgery, then what you can do after your competitive entrance exam is to opt for a career in MD Community Medicine. Last time I spoke to you about why community medicine is the sexiest profession of the 21st century. It still is. If you've then done your basic sciences, then what option you have is to do your MPH, which is nothing but a Master's in Public Health. You can do it from whichever university you like to. It's just that different countries and different universities which offer an MPH have different regulations which you need to check on their website. What you then need to do after an MPH, it is very important that you do your PhD or you do a DRPH, which is the Doctorate in Public Health. Why do I say so? Because once you enter the industry or the market, you would be directly competing with MD Community Medicine guys. So an MD in community medicine is equivalent to a PhD. Remember that. There are some people all around the world who will tell you, no, it's not equivalent, but that's not true. What is an MD? An MD is a doctor of medicine, and PhD is a doctor of philosophy. So both are the same. Do not mistake that. So if you want to be on equivalent lines after a master's in public health, with an MD in community medicine, it's very important that you do a PhD or a DRPH. There are multiple career options which you can then do once you have finished your MD in community medicine or once you have finished your MPH, PhD. What are those? Of course, if academics is your line of interest, that's the natural thing which a lot of people look at, is joining a medical institution or a school of public health in a university. That's one of your many community medicine and public health options available for you. What is the other thing that you can do? You can join as a community health physician, work in an NGO, work in a research organization, go to the field, make policies, interact with policymakers and parliamentarians. See that real change in front of your eyes. See history live. Another thing what you can do is join as an epidemiologist in a research organization, in an international NGO. That's also something which is up for grabs. What is another thing that you can do is join government departments, the Directorate of Health Services, or you can also join different arms and wings of the government like NACO, like RNTCP, and other government programs, including Ayushman Bharat. It's wise to stake your claim also as a district health and family welfare officer, which often so is more a politically provided post. Why should a MD community medicine or a MPH, PhD not be made a district health and family welfare officer? What stops them? Nothing stops them. That's where you need to stake your claim. Another option which also is available for you is to join inter-country organizations like UNICEF, WHO, World Bank, UNDP. I get a lot of requests from young minds who've just finished their MD community medicine or those who've enrolled into their MPH. It's like they often come out, reach out and say, hey, you know what, can we join WHO? We want to work in the headquarters. Give it a thought. Why should WHO Geneva entertain a fresher? You have people all over the world who are working in different spaces, who've worked in the field for 10 years, 20 years, 30 years, who've now made it to the headquarters. So don't you think it's wise enough to first start at a district level, move or grow at a state level, then comes the national level, and then comes the world headquarters? I'm not saying it's not possible. It is possible, it is achievable. But you also need your country government to recommend you into the headquarters offices. Another thing which a lot of young minds who finish their MD in community medicine or MPH first seek out is they want to work in a metro city. Like, hey, do you have jobs in Mumbai, Delhi, Bangalore, Chennai? I mean, why don't you want to work in a tier 2 or a tier 3 city? Go there, work among communities, be that real change, work for some years, implement programs, policies, curate new programs, see that change, be that change. Then maybe you can come into a metro where you have the baseline knowledge on ground and then you move into a metro. What happens a lot of time when you directly move from a theoretical database of a degree and then move into a metro is you do not have grassroots experience. And then you make policies for people whom you're disconnected with. That's why a lot of times at Nirman Bhavan in New Delhi, the Ministry of Health stands disconnected from the ground. What does any insurance scheme, what does any popular government scheme mean to the last mile person? It means nothing. Many a times, these community folks are not even empaneled into it. Today we talk about the global goals on sustainable development. We're talking about the Paris Agreement on climate change. We're talking about the Addis Ababa Declaration. We're talking about number of commitments where country governments are committing to the cause they believe in, which is close to their heart. But what does this mean to a deputy commissioner of a district? What does this mean to a person sitting in the village? It means nothing. That's where public health matters. That's where you really need to go to the ground. I mean, once you're a senior in the system, once you've achieved your bit, there is a natural, normal tendency saying that, hey, you know what, I've worked for 10 years. So it's fine that I sit in an air-conditioned room. But you're not going to achieve real concrete change. That satisfaction which really cannot be put into words, but only appreciated in the remembering, can only come if you're willing to go to the ground, get your hands dirty, work in the field, interact with villagers, and see that real change which you envision in your mind. That's what you need to do as an MD community medicine and as a public health person. The next question which comes is, hey, how much am I going to get paid? Is payment the only criteria? Think about it. It's okay, everybody understands that you have a job to do. You need to run a home, you need to support your family, your near and dear ones. But how are you wanting to achieve that? That cannot really be achieved just by focusing on what's my pay, what's my annual income. No, your focus has to be on experience, on grassroots work, on real community change. Payments and money will follow. I mean, I've grown up to believe in the fact that yes, when I had nothing, there were a lot of people who supported me, both in cash and kind. What's most important for each of you to remember is focus on experience, focus on work. And also, if you think that your boss is bad, don't continue in that workplace. I mean, there's no point working for a person who just does not encourage you and help you grow. It reminds me of a saying by Richard Branson long ago. He said, train them well enough so that they may leave. Treat them well enough so that they don't want to. That's about finding a good boss. That's about working in the space of public health. Thank you. Don't forget to subscribe to this channel for more such videos and also tap the bell to receive notifications. Have a nice day.